Okay, so that's a big no-no. Actually, remember the two hit hypothesis I mentioned?
Yeah, but he wasn't here for that, but yes.
Yeah. So people who are genetically predisposed to epilepsy, the head injury can trigger the onset of seizures and epilepsy. And actually, we submit a paper from our group recently. What we noted was very interesting in that group of veterans. They were fine. They didn't have anything, or they might have febrile seizure as a child. And then they went out to join the service. They were fine until they got a head injury.
Okay.
And then intractable epilepsy kicked in. And it's not a type of epilepsy typically from head injury means partial epilepsy. It's a primary generalized epilepsy means it's a genetic epilepsy.
Yeah.
So the genetic epilepsy seems to get...
He has genetic epilepsy.
You have genetic epilepsy, okay. So the genetic epilepsy got turned on by the TBI or got much worse. In general, genetic epilepsy are easy to control with medications, at least in our experience, not every one, but most of them seems to be easier to control. Those group of patients we just described in our paper we submitted, we're going to get it published because it seems we're doing some minor revision now, but it will get accepted.
He is medically controlled at this point. As long as we keep him,
okay.
As long as he doesn't miss too many medication doses, he's good.
Okay, but the scary thing is,
yeah, not anymore. Oh my God.
TBI could much worsen the easy to control genetic epilepsy and make it really intractable. So I don't think you should avoid any head injury from this point on. And then whether you have that post-traumatic progressive encephalopathy or not, you just need an EEG study. If your EEG is in general normal, unless you just have a few spikes and you don't have that condition, that's
EEG if it's normal or just a few spikes?
Yeah, then that's fine. Usually the patient with a post-traumatic encephalopathy patient, the whole EEG is abnormal. The background rhythm is too slow, means they are encephalopathic. They are not dementia, but they are a little bit like demented patients. They don't have the
Your
attention.
last EEG was normal.
Yeah, is that a good way to see if...
To know that you are not in that condition at this moment.
Yeah,
okay?
this moment you
But let's come back to the more detailed things. She mentioned you have attention problem. That really could be from repeated head injury.
Right.
The most common problem with repeated head injury, one is attention. Pretty much everyone has it. Second one could be a memory problem. You could have a little bit of memory. The third one could be anxieties.
Did you say anxieties?
Anxieties, very common.
Yeah.
Yeah.
Almost like OCD tendencies with anxiety, kind of mixed in
OCD
there.
is a different thing.
Right.
I'm talking about
He gets like over worried about situations or stressed out easily over things that you and I wouldn't even freak out about.
Okay, that's more PTSD.
Okay.
Really.
Interesting.
Yeah, if you so easily stressed out or you have a very low threshold for angry outbursts,